Hi everyone, welcome. I'm Linda. I guess you're in the right room if you're looking to listen to a webinar about private clinics. So we should kick off in about 2 to 3 minutes. I'm just waiting for everyone to come in. So can you all see me and hear me? I think you could just put a reaction. You can just put a thumbs up or react or just say something um in the comments box, in the chat box. Can you all see me and hear me? I just want to make sure my mic is working and my camera is working. Renee, thumbs up. Fab, fab, fab. Okay, I'll start soon. Okay, I'm hoping the audio is okay because I have a fan blasted at me from the front and also one at the back of me. You can probably see it in the back there rotating. So hopefully it doesn't distort the audio. So let's just hang on a couple of minutes. I'm going to share my screen and then we'll just wait for people to come in. And it gives me a chance to get some water. So just bear with me a couple more minutes.
Do they give a piece of the beef to dog? Are they cross? Are they?
Can I have an ice cream?
Ask him, yeah.
Okay, hi everyone. Welcome, welcome. Can you hear me? I think someone needs to be on mute. I can think there's sort of background noise. I can hear myself coming through. Fantastic. Excellent. So my name is Dr. Linda Adogwu. I am the founder of ThankStock, and today we're going to be talking about private clinics. So we can kick off. I'm just going to put some links in the, one second. I'm just going to put some links in the chat because I always forget to do this during the webinar and get to do this, and I leave it too late, so then people don't have the link. So let me just put some links in the chat just before we start. Okay, don't. I'm going to put it in the chat. So where is everyone coming in from? How many people do we have on? I can't even see this. I am definitely not a Microsoft Teams girl. I'm more of a Zoom webinar girl. So I don't really know how to use Microsoft Teams. So sometimes you're talking to me and I can't see what you're saying, especially when I'm presenting. So feel free to shout out, especially ask questions during as we go along. Let me just post it here. So yeah, and just be sociable. Most of us are GPs here. There might be a few businesses that are on the call as well, but this talk is mainly targeted at GP. So yeah, feel free to have a chat. Where's everyone calling in from? What do you do? Are you a GP? Are you a business? What are you hoping to get from the webinar? To have a chat amongst yourself. I'm going to go through. I've got about 45 slides, so it's a bit much. I'm going to talk really quick and try to cover everything. Feel free to interrupt me as we go along if there's something that is not quite clear, or you want to ask any questions, or just have a bit of a chat. So this is very sort of a very relaxed setup. So I'm going to share my screen again, and we will start because it's about 7 minutes past. I think it's a good time to start. I'll just enlarge it. There is a bunch of teams, so yeah. So this talk all about private clinics and how to start your private clinic, how it really works, how you can get in. So if that's the talk that you've come to, just stay tuned because we're going to go all through it, and we're also going to have a little bit about the Uber Doctors model. We're just going to whistle through it, and I can just show you a little bit of the platform, but that's at the end. So if you're only here for the private clinic talk, that's absolutely fine. We'll cover that at the start, and then we'll do the Uber Doctors at the end. So if you can't hang around, then that's at the end. This webinar is recorded. We are going to try and put it on a sort of YouTube channel, so people that can't make it normally can just recap. So can you see my screen? If not, just let me know. Just someone shout out, can't see, you can't see my screen. Otherwise, I'm just going to go. Okay. Oops. Okay, fine. So yeah, that's just the agenda. So who are we? So we are the only digital and physical doctor on-demand service in the UK. So what do? We match doctors with businesses who need doctors. So Some of you have already seen a few of these slides, but I do the same format in. Try to minimize this. I don't know if you're actually seeing my things. Something's in the way. So I've seen some of these slides if you've tuned into the past webinars, but it's only the first couple of slides that are the same, and then we go through the new content. So we match doctors with businesses who need businesses. So we're a B2B2C model. But what do we really do? We want to really empower GP to work flexibly, to feel valued, to be paid well, and to avoid burnout. Oh, let me go to the next slide. Sorry, this is so slow today. Oh my gosh, it's a bit slow brain. So when I said that we're the only business that does this, so the only type of business, actually, I put this post up on LinkedIn. So anyone that follows me on LinkedIn would have seen this post. So my CQC assessor actually said, in 30 years of doing this job, I've never come across anything like this. So we're actually the only platform that allows you to see patients wherever in England, not in the UK. CQC mainly only regulates healthcare activities in England, not only online but also in person and home visits, etc. So we're the first model like this, and where we onboard a number of GPs. So we're aiming to get up to 10,000. We have a wait list of about 4,500. So we're the only platform that has this mass of GPs, and we can basically do any regulated healthcare activity throughout England. So a little bit about me. I'm a GP. I've been a GP for about 2017, so about 8 years now. Yes, 8 years, gosh, nearly a decade. And I've done a number of things. I'm one of these people that have ants in my pants, so I literally can't sit still. I have to try my hand at everything and anything that looks like interesting. So I was a GP supervisor. I had my skin clinic in Harley Street, and you can see my skincare brand. I did a few of the expos. One second, I've got chewing gum. It's so rude to be chewed. One second, I'm just gonna take it out. Yeah. So I've done a few expos, so you can see a few of my photos where I was exhibiting my skincare brand in some of like the beauty and aesthetics exhibitions and trade shows. I came out with my own skincare products as well. I've done clinic consultancy, so I've helped a number of businesses start up their clinics. So whether it's IV clinics or GP clinics, menopause clinics, so different types of clinics, and particularly aesthetics clinics, because that was the industry I was in. I've dabbled in properties, so I had a few properties. I've also launched CPD courses. So I was teaching people how to treat skin of color using chemical peels, which is an aesthetic or beauty treatment. And I've done cosmetic formulation. So my mantra is to fail fast and to fail forward, because you can literally only learn by doing something. And it's like riding a bike. You're never going to get it right the first time. So it's always good to just try, learn, and move on and be better than what you did the previous time. That's a little bit about me. So let's just jump into it. How do we work? So we work in two ways with our GPs. So we work in an Uber doctors model, and we work in a private clinic model. So GPs can do one option or both options. So the Uber doctors model, they sign up to the platform and they get pinged jobs. So the jobs could be anything. So it can be from, for example, a quick 15-minute online consultation or a private 3-hour menopause clinic at their local pharmacy. So that's how the Uber doctors model is. Basically, we have a platform full of GPs. The businesses that need to request the GPs request it on our platform as well. GPs get pinged, there's a job here, and then they can decide, okay, accept or decline whether they want to do that job. So that's our Uber for doctors model. Then we have a private clinic model. And this is where you can launch your own private clinic under our CQC umbrella and our infrastructure and get up and running within a week. So that's the two ways in which we work. So for the Uber doctors model, we partner with a number of businesses that need doctors to provide services to their patients. So this also includes the NHS. So we have a few practice managers onboarding, so GP surgeries, even the recruiters, so the recruitment agencies that place GPs within the GP surgeries. So we work not only with the NHS, but also with private companies. We've got a lot of health tech companies. Health tech is really booming at the moment. So a lot of health tech companies that want to start also want the GPs to, for opinion or to lead in certain service areas. We also work with online blood testing labs. So these are labs that actually sell blood tests directly to the consumers. And if the result comes back abnormal, then that's when they request a GP from us just to go through the blood results and to advise that patient, because they can't, not that they can't afford, but it's not cost effective for them to have a GP sitting there, full time for, one or two blood tests that might come, blood test results that might come back normal. So we work with a number of providers, and you can offer a number of services under our doctors. So the same services that you can offer in the NHS is the same service that you can offer with us, because we have partnered with these service providers. So, for example, private prescriptions, we work mainly with Quincy Health, and they're so electronic prescriptions provider. So on their platform, you can prescribe any medication, and it goes directly to the patient via online prescription. So it's emailed to them, and then they can take that prescription to a pharmacy who puts the code in the system and brings up the prescription and then dispense it. So you can do private prescriptions, you can do blood tests. We're partnered with blood test laboratories. You can do scans. We're partnered with the sort of imaging and radiology services. And also the services that, or the competencies that you have. So people might have done a course in joint injections. Those services that you are able to offer as well to our patients. So you can offer any service that you have a specialist interest in or you have expertise in. So in terms of private clinics, yes, let's go on to private clinics. We'll just kind of cover it here. I think I can't remember what the next slide is, but I think we'll go into it in a lot more detail. So how do we work? So we really want people to get up and running quite quickly, okay? And you can do this by coming under our CQC. So CQC, Care Quality Commission, is legally you need to be regulated by CQC if you're providing any of the, they call them regulated activities. So if you're treating disease and disorder, if you're doing diagnostic and scanning, there's a number of areas of regulated activities on the CQC that actually, if you want to offer these as a doctor, then you need to be regulated by them. So you can come under our CQC. We cover you for your indemnity, and that's £19 a month. So we actually work with a really good, well-known medical indemnity provider. And because we have the number of GPs that we have on our platform, they're really able to drive down the price of private practice, because a lot of the time people found it was really difficult to start up because of the cost of indemnity. And even when I was to start up my own GP clinic, private GP clinic, it was around, I don't know, 1,600 I was quoted per month based on 6 hours a week. So about 24 hours in a month. So it was about £1,600. So it's quite expensive. So not only do we offer the CQC and the medical indemnity, we also offer the clinic support. When you first start something, you're never going to be good at it. There's always going to be mistakes. So rather than make those mistakes by yourself, we almost give you the shortcut to say, actually avoid this, do this. So you learn with us and you learn from us and what we've been through. And also you'll be with a number of other GPs that are in the same cohort as you, all building their clinics. So it was just good to have that support, that WhatsApp group where you can sort of ping each other ideas and help each other through it. We help you find your clinic location. I'm always one to say, just minimize your cost when you start. Don't start by, buying a GP surgery, like buying all the equipment new, like whether it's the bed, always start very low. Always start by leasing or renting per hour. So we work with clinic locations where actually you can just rent it for £15 an hour. And to begin with, to be realistic, you're not going to get sort of droves of patients coming in. You might even just get one or two, but that's how it starts. Unless you're partnered with a business, patients coming in will be very slow to start with. So you don't need to have a clinic there and be there all the time. You really just want to test the waters first. And the way that you do that in the most cost-effective way is, just renting your clinic location, like a clinic room somewhere. So we have electronic medical record software included. So we've built our own bespoke platform, which is GDPR compliant, and we're registered with the ISO. So I think you have to, ICO, Information Commissioner's Office. So to make sure that actually the data is protected, you're doing all the right things. So some of these medical record software are very expensive. So the major player, when I was doing my aesthetic clinic, I was with one of the sort of major providers of electronic medical records, and that was probably costing me £100 a month. So this is all included in your private clinic sort of fee. Electronic prescribing, including consent forms, website and patient booking platform is additional cost, and we'll go on to that a little bit later. And also you get to use our referral partners. So the partners that we have in terms of the laboratories, the scans, the hospital consultants. So we have a lot of the private, the secondary care, sort of the private hospitals that we're partnered with. And even if you're on our Uber platform, you'll get to start know the consultant, because they'll be doing our sort of monthly CPDs and our teaching sessions in different clinical areas. So we want to just give you everything to start. So it's sort of at your fingertips, and you feel really supported once you're starting your private clinic journey. So why are we doing this? A number of reasons. So these are just some of the news headlines. I always do this in my webinars, and I try to find like the kind of relevant headlines that have been happening, you know, over the past few weeks. So this one, I think it was today I saw this one. A third of GPs plan to quit patient care in the next 5 years. That's like a huge number, and it's just saying that because of low job satisfaction and burnout are the most common reasons cited. Also, we have a surge of PCNs, or primary care networks, exploring incorporation after the 10-year NHS plan was released. So I think I don't really understand it. I'm not sure whether any of you can understand it and explain it a little bit better. But with the government 10-year NHS plan, I think they wanted almost to have the hospitals managing primary care. I think that's why I understood by it. So I think the primary care networks are now thinking, okay, are we able to find a way actually which we can incorporate, rather than having some of the secondary care trust managers? So it just, I don't know, it just seems a bit strange. So it's a good time to actually start thinking about your plan B. What is this one called? Pharmacy. Okay, so pharmacies are transitioning from dispensing prescriptions, which is how they used to make their income, to clinical services by 2030. And this is actually because their funding is also being squeezed, the same way as general practice funding is being squeezed, the pharmacy funding are being squeezed. So you can see that this is happening anyway, because I think from 2026, all the pharmacy graduates will have like license to prescribe. So they'll have prescribing rights. So you can already see that actually, as pharmacists, usually they dispense, they don't prescribe unless they do this prescribing course, but actually a lot of them don't do that. But now incorporated into the curriculum is their ability to prescribe. So you can see actually now they're going to be doing more clinical care rather than dispensing. So it's just something to be aware of, and sort of understand, okay, where is it going? Where is this taking us? Or what is the writing on the wall telling us? Here it says, you know, thousands of GPs still struggling to find enough work. This has been going on for ages and ages, and I've personally spoken to quite a few GPs that haven't been unemployed. But I think the longest was up to 9 or 10 months. You know, they just can't find work, and the work they find is very scarce, and the rates are very low, and it's just a mess. You know, it's just not sustainable. You can see here the rising patients per GP. So this is June 24. I think at the moment, I think the number is closer to 3,200 patients per GP, when it was meant to be on average 1,800. So you can see actually the number of patients per GP is rising, but unfortunately here GP pay is falling in terms of real-time equivalent when you take into when you factor in things like inflation and cost of living. So with real-time equivalent, the salary is falling and the patients are rising. So more work, less pay. You know, we have to sort of think where is this going? And also record low satisfaction with NHS GP services. More patients are going private to avoid GP and the referral black hole. I mean, you refer a patient and they're on the waiting list for ages and ages, and they're just not getting the care that they deserve or they expect. So those are a few reasons why we're doing this. So let's talk about private clinics. So I'm just having a look at the time, because I always run over, and I'm just trying to keep the time, particularly because I don't want this webinar, which is recorded, to be more than an hour. So private clinic platform. So we sort of run through this slide. So we want you to get up and running in a week. And how we do this is that we get your website up and running. Some of the GPs already have websites, which is great, but some of them don't have websites. So we actually work with our tech sort of partners. And you can see here on demosites.thanks.co.uk, you have a number of templates that you can pick from. And you can say, you know, I want this one, and then you book it in, and you can collaborate with the our sort of web developers, and you can actually explain to them what you want the website to look like. You know, if you wanted to put like a WhatsApp widget so people can contact you directly from your platform, which is a really good idea, and I use that on my skincare platform, because sometimes customers just want an answer, and if you're able to answer them instantly, it's like you've got that customer. And that customer is not just like a one-off. Usually the customer does stay with you for life. So actually the lifetime value, business, you call it LTV, of that customer is really high just because you're able to communicate with them very, very rapidly. So we get your website up and running. We can put the WhatsApp widget on. We can implement, how patients book in, and to make sure that actually they book in and they pay at the time of booking. And then also the video consultation link gets sent to them and gets sent to you. So it's all very streamlined and efficient. We can help you with like the consent forms, help you with SEO, and also, how to get just simple things like, okay, how to get like a local number. I think for my telephone number, I think I pay like, I don't know, $2.99 a month or something like that. Location assistance, register on Google Business. So it's really important so people can find you. We all know that actually, whenever we're looking for a service, where do we go? We go onto Google. So if you're really not on Google, you might as well just not even bother, because patients aren't going to find you by walking past the pharmacy. They don't know you're in there. So actually, you need to make sure that your website is SEO optimized. So search engine optimized, so patients can put in words. So when they're searching for menopause doctor near me, you might have a menopause website, and we've got enough information on that website to tell Google that your website's for menopause, and therefore that you come and you rank in the results when the patient is searching. So and also we have once you're under us, we'll have a referral network. So you'll be part of our referral network, in the sense that it's really good to get out there and tell people what you're doing. And that's what I'm doing today, because if you don't get out there, people don't know who you are, people don't know about your business. So it's really difficult for them to find you. So in order to get out there, you just have to start. So once you even start on a platform, there's an opportunity for you to teach, whether you want to teach the way I'm doing a webinar to you guys today. You can teach the other GP just to say, hey, this is what I do, this is who I am, and this is a service that I offer. So if, for example, I'm consulting a patient and this patient, needs a menopause GP, my strong point isn't menopause. I can sort of kind of get by, but it's not my strong point. So my specialist interest is dermatology, particularly in skin of color. So if I know actually Dr. Smith is doing menopause, that's who I'm going to refer that patient to. I know he does a good job. I've seen him, I've heard him. He uses really good medication. He's talked us through case studies and patient results. So actually, you become part of our referral network automatically when you come under opening the clinic with us. 1 second, just double check it. Okay, and this is some of our websites. So you can basically have the website, have your logo there. So how the website works is that it's fully customized to you. So it doesn't look like we're there. It's only at the bottom of the website it will say powered by ThanksDoc. And it's really important. We're going to go go through CQC regulations a little bit later, but it's really important that actually your website represents you and what you want to do. So all the writing is customized. Like if you wanted to have a menopause website that looks like this, and you can put like best menopause care or best menopause treatment or whatever. So you customize your website according to you, but then your policies and everything else that is sorted out by us. So it's almost like you're like the front face, and we're almost like the back end of all the logistics, infrastructure, processes, policies. So that's how it works. So things you can do under our CQC. So you can do a number of things. So you can do online consultations. If you just wanted to be solely online, that's absolutely fine. If you wanted to be in person, you do in-person consultations. So have your clinic somewhere, or have multiple clinics in different areas. And that's really good, because actually when people are searching for you, when they search Google, if you're in 3 different areas, then you're 3 times more likely to rank up when customers are looking for you. So yes, you can have clinics in multiple areas. You can do home visits. You can work from anywhere in England, as in see anybody. You can see anybody located in England. You can see any age. So our CQC allows ages from 0 to 100 or plus. So any age, whole population. That's how they call it. Because some CQCs, when people request or apply for CQC registration, they might say over 65s or under 65s or 18 to 65s. So it's really important to know what CQCs are, if you're doing it by yourself or going with enough agency, to actually what age group do I see, because actually the age group you see is very important, because then you have to have policies in place in order to safeguard that age group and also to work differently with those age groups. So you can see any age, and we can do anything that is GP related. So what is great about general practitioners and general practice as a whole is that we're generalists. So if I wanted to start up as a skin specialist, so I'm not saying I'm a dermatologist. I'm saying I specialize in skin, or I have a specialist interest in skin of color. So you can do any clinic that you like and market yourself in any way that is a primary care sort of service. So some people do, joint injection clinics. So they're not orthopedics, they're still GPs, but with a specialist interest in, I don't know, musculoskeletal medicine, and they do joint injections. So any GP type clinic you can set up, and also aesthetics clinics you can set up. So also CQC doesn't regulate aesthetics, but they regulate some aesthetic sort of services. So IV drips, so vitamin drips have to be CQC regulated because vitamins through delivered through the veins are seen as a treatment, and you're treating a disease or disorder. So that's actually why it's important that actually aesthetics, particularly IV drips, is a CQC regulated activity. And I think that was recently, maybe in the last 2 to 3 years. Before it wasn't. And now, the aesthetics sort of what's happening in aesthetics is changing quite a lot, and they're being really heavily regulated, because before it was like the Wild West. And I'm sure you've all seen these stories in the Sun or the Mirror or whatever, saying I was botched by this practitioner, or botched Botox, or I think the most recent one is that I got botulism from Botox, because they're getting the Botox from Korea, and they are injecting it, random people injecting it. And I remember when I was in Harley Street, I came out of my clinic, I could see all the ladies, with their local anesthetic, like the Emla cream on their lips, like preparing to go in. So I on my way out, I saw a practitioner that came out of there, and I said, "Oh, okay, I saw like all your patients, oh, that's great." So we were just having a chat, and I was like, "Okay, so are you a doctor?" And he was like, "No." And I was like, "Oh, so are you a nurse?" And he was like, "No." And I was like, "Oh, so what do you do?" I was thinking he was going to say, I don't know, physio or pharmacist or something. And he said, "I'm a chef." And I thought, "You're a chef? How?" So yeah, during the daytime, you're like chopping up meat, and during the nighttime, like in the evening, you're just like injecting people's faces. It was just so bizarre. So like aesthetics is like coming under like massive scrutiny, and it's all there's now, you have to go through proper degrees and proper courses. I think to get qualified in aesthetics, because actually, it's the Wild West out there. So you cannot come under us. I kind of deviated, but you can come under us for aesthetics procedure. So things you can't do under our CQC, and we have safeguards in place. So you can't prescribe all them dodgy or risky drugs. So really risky drugs that actually you have to understand from our point of view, we're going to have over 4,500. So we have a waitlist of over 4,500 GPs. And that was a waitlist that just came within 6 weeks. So we can't monitor every single GP and what they're prescribing. So these risky drugs that you can't prescribe. So we say on our medicines policy, so you can see our prescribing and medicine policy, okay, no, of course, class A to C drugs, and no schedule, I think 1 to 5 drugs. So all of the Z drugs, Zopiclone or whatever, those can't be. All the benzos, they can't be prescribed. Even the amitriptylines, and that's because there's been issues with patients that are requesting medications like this from different online services. So and also sometimes they decline, that actually they don't want us to advise their GPs of what we've prescribed them, and they're well with them in their rights to decline that. So it's all, if they withdraw their consent or don't give consent for that, then we don't prescribe. So actually, when you're prescribing these medications and the practitioners, the GPs are not talking to each other, it can be actually quite dangerous for the patient. And that's why I actually just said no dodgy drugs, no risky drugs. Let's just keep everything very safe. Just because of the number of GPs that we have. And we have safeguards in place. So our prescribing platform, so we use Quincy Health for prescribing. And actually, sometimes you're working on a platform and you can be working with a number of providers, and it just is like a lapse, like a memory lapse. You're thinking, can I prescribe this or can't I prescribe this? You just don't know. And you're thinking, but if you try to type in a drug and prescribe it, you'll actually be stopped. So there's no way you can advance through prescribing, Zopiclone or, diazepam, because actually we don't allow it. And that's just to keep you safe, to keep patients safe, and just to keep service running smoothly. So we can't see, so if you come under our CQC to open your private clinic, you can't see patients in Ireland, Scotland, Wales, or anywhere else. So it's just England at the moment. But England is big enough to start with, because with CQC, it regulates different areas. So with Wales, they have Health Inspectorate Wales, Health Inspectorate Scotland, I can't remember what it's called in Ireland, RQIA or something like that. So every country would have its own CQC. So we're only regulated for activities and patients that we see in England. And some people say, oh, can you work from abroad? So with our indemnity and our insurance, they don't mind where you work from. They just mind where the patients are based. And that's because they want you, and and where you're registered, of course, to provide medical services for. So they want you to make sure that actually, if there's an emergency, you know how to contact, the emergency sort of services. So they don't mind actually, you're on holiday, but you have like a private room and no one's going to disturb you and it's all fine. But you've got, seen like a notification come through saying, okay, I want to see a doctor, and it's a quick consultation, online consultation. They don't mind where you're working from. They only mind where the patient is based. So it can't even be an English, a patient that's usually based in England, and now they're in Sri Lanka on honeymoon and they're contacting our services. So no, the only patients based in England, that's who we can see. And also only GPs on our platform. Because as a GP, I know GPs. I've been a locum GP, and this is basically like a locum type platform. So I've been a locum GP for a long time. I think I've only had one salaried role, and that's when all the locum work dried up, and I had to maintain my minimum number of sessions. So from 2017, I think I was the only person in my cohort as well that went into locum GP. Everybody else was like salaried or partner straight away, and I'm just like, no, I've got my ants in my pants, and I just need to try different things. So we only work with GPs because that's who I know. That's who I know. That's how I know. I know how GPs work. I know all of the kind of locum, like the onboarding. So I just know GPs, and that's literally the only reason why I said, okay, this platform is only for GPs. And GPs have a multiple skills and they can cover everything. And GPs see 90% of the patient population, so we're pretty much covered in terms of. Sometimes if you recruit like nurses or physios, you're not really sure of their skill set, and it just becomes a little bit muddled when we're trying to have a massive service, and the logistics are a bit of a nightmare. Also, no secondary care type services. So most of the time we're online, or we're practicing in our clinics, and our clinics are our pharmacy partners. So the pharmacies usually have a consultation room somewhere in the back or to the side. So that's where we go and we do our consultations if a patient wants a face-to-face consultation. So that's where we'll have our clinic bases. So we partner with a lot of the pharmacies, and that's how we can sort of expand throughout England. So it's not like we're buying clinics and setting them up. So we just work with our pharmacy partners. So, and sometimes I have to audit and do these kind of spot checks and these kind of like secret shopper, these surprise visits just to say hi. Let me just make sure that everything is in order. So we can't have somebody who, I don't know, has a specialist interest in fertility and, I don't know, doing a hysteroscopy in a pharmacy clinic. So no secondary care type services, even if you're like good at it, and even if you've got the qualifications and you've collected the certificate, we just want you to be safe. And actually, we just have primary care type services. Okay, so it's this warning, because I know there's a few services that you may have seen come under our CQC, and I'm all for competition. I feel like competition like sort of pushes us, but also we learn from each other. And I think the pie is big enough for everybody, So I'm not someone who's like, try to like bring down or bash the competition. But actually, some of these things, I've raised my eyebrows at a little bit, because people have said to me, when they're coming on board in terms of their private clinics, oh, I've spoken to this provider, and I've spoken to this person who's also saying that we can come under their CQC umbrella. I'm like, really? Because actually, I know that CQC have told me personally that they've never approved a service like this in England. So I think the other services, and it can't be an afterthought. It's not like you can be set up to, provide these regulated services and then think, oh, actually, that's a good idea. Maybe people can come under my CQC. It just doesn't work like that. So it can't be an afterthought. It has to be very, it has to be built into your business plan. So, and it's shown in your policy. So when you're doing like the interview, they might say, how would you, they actually ask me, how would you manage the, 5,000 people, 5,000 GPs prescribing? How do you know there's not going to be one rogue GP, like a shipman, trying to cull off those little old ladies and prescribing them morphine all the time? And I'm like, so that's why actually some of the people that we work with, we have to have these processes in place where actually, if you go on our prescriber platform, you physically can't prescribe these, risk or dodgy medications. So all of the policies need to reflect the business structure that they're trying to work under, if that makes sense. Sorry, I'm forgetting my words. You guys know me that I forget my words in the evening because I'm tired. I'm definitely a morning person, not a night owl. So when somebody comes to you and and they might be legit, maybe they can have people work under them, but you have to have access to all of their policies. These are regulated services, and CQC actually come down very hard, and you can be fined or at worst imprisoned. It's a criminal offence to basically provide these services and not be regulated. So have access to their policies. You need to have access to their policies. So even on our platform, we have a knowledge hub where actually we list all our policies. So if you're thinking, okay, what is complaints policy? You need to have access to it. So actually when someone comes to complain, you follow our policies, and if there's anything that kicks up, like the insurance companies know, everybody knows, everyone's on the same page. So yes, it gives good quality care, but also it makes sure that everything is standardized. So some people that say, yeah, come and work under us, and they don't give you access to the policies, that's already like a bit of a red flag. And the policies are always updated. So it's not like, okay, I'm going to email you all of our policies. What about when you update them? So our policies are going to be updated every 3 months. We're checking them to make sure, because we're getting feedback. Okay, this is not working. So if something's not working, then we tweak our policies and it's there. The most current version is on our, it's not an intranet. It's basically, it's almost, I don't know what to call it. It's also on like a subdomain that you can have access to. It's like a wiki page or something. So you can always look up our policies just to make sure that you're practicing correctly. Also, look at their provide. So when you apply for CQC, you have to have a new provider application form. So you fill out this form, and it basically says, this is what I'm going to do. This is where I'm going to do it. These are the locations. These are the services I'm going to provide. This is how the patients are even going to book. This is my GDPR. There's about 50 policies. It's actually crazy. So if anyone has ever gone through it, they'll know. So you have to make sure that actually look at their new provider application. Does it actually say they can take on GPs? And if so, well, what location can they take on? Because again, if you're operating on a location that is actually not in their application form, you're operating illegally. So I just want people to understand it's not just about, oh, let me go with this person because they're cheap, or let me go with this person because it's fast. It's about actually really looking through their policies and making sure actually, as GP, sometimes you can't get away with saying, oh, I was blissfully ignorant. You should know that actually, with good medical practice, when you're reading all the guidelines, you should know actually CQC activities are regulated and it is illegal. There are legal implications, and actually you can't just go with someone and just say, oh, because they told me so, then it's okay. As we know, what adage do we always go by? If it's not written down, it's never happened. So make sure that everything is in writing. You have access to everything. Even their terms and conditions. That means you can now come on with their terms and conditions. Make sure you understand them. Make sure you even understand things like lone working, because they're saying, well, Linda, you're sending out GP to do these home visits. How do you know a GP is not going to be just, kidnapped or with some sort of lunatic and they're just there? So even we have to have those policies, and we have to have the technology to monitor. We have like the GPS tracking with the GP, so when they're going on a home visit and they have their buddy system, they have their next of kin that they tell, number one, but also the GPS that they sort of set when they're going to a home visit. We know the home visit shouldn't take more than an hour and a half. So if they're there for an hour and a half and we call them and they don't give us the safe word, we know that we're already calling the police. So all of these things have to come in with the policy, because if you're doing things that are not kosher, then you could get in trouble. Look at even their online service provider form, application form, because if you're just doing online, CQC actually finds that this is more dangerous. So they're scrutinizing it even more, because there's been like lots of patients incidents and issues and deaths by online service providers. So they're looking at it very, very closely. So make sure that actually you're aware of what's on their website, what's on your website. And that's why actually when you come under us, you have your own website, but your policies are exactly the same as ours. Your terms and conditions is a copy and paste job. All of your protocols are the same. So it's just the front face and you that is different, but everything else is our infrastructure. And yeah, pay attention to the clinical governance. That's a biggie. That's a biggie. If anyone has any questions, just shout out. I can't see anything that's happening on the chat. I can't see the chat. So this is a chat GPT. I guess people that use chat GPT can see the font. So I basically said, okay, chat GPT, show me sort of a breakdown of costs of setting up on your own and running your clinic under Thanksgiving. Actually, it's given me this, which isn't bad, but actually I've looked at it. I'm like, oh my God, there's so much more costs to it. So yes, you have the CQC registration fee. CQC registration, that's the registration fee, but actually you usually go with CQC consultants because you're doing it the first time. I would say never go it alone for CQC the first time round. And these consultants charge from 6,000. I think the top that I was quoted was about 15,000. So they help you with your policies. They basically handhold you through the process. So yes, that's a registration fee, and the registration fee is annual. And it depends on how many activities that you're regulating and also the locations that you're in. That's how the cost is. And there's a page on CQC website that tells you the breakdown of how much it will cost with regards to what you're doing and where you're doing it. So yeah, compliance setup, so like policies and templates, premises, so rent and utilities, 2,000. It depends on where you are. In London, you'll be like fast stretch to find a clinic for 2,000 a month, because with even business rates, sometimes it's more than the rent. So premises can be quite costly. Medical equipment and furniture, insurance. So this is where I thought actually it's not just private medical indemnities, our own insurance, but then there's cyber insurance to make sure that actually someone's trying to hack you and suddenly like all your patient data is all over the internet. You've got insurance for that. You have to make sure that you've got public liability insurance. So if something happens to they're in the pharmacy and I don't know, they trip over, or they're in a clinic that you sort of own, and they trip over and break their arm, whatever, and they sue you for it. You have to make sure you've got that. So I think there's about 4 different types of insurances that you have to have. Even as an online GP clinic, you have to just make sure that you have these in place. Admin and booking system, they can cost around £100 a month. Marketing, gosh, this one, £2,000 a month. That's not even touching it. So I know even some pharmacies, some doctor surgeries that are spending 100,000 a month on Google ads. It's crazy, and I've even done Google ads myself. I think I'll spend like, I don't know, I think about 1.5 to £2,000 per month. I stopped that very quickly because it will just bleed you dry. You'll just be closed within like months. And I've spoken to 2 or 3 doctors, that try to do good, try to launch good services with really great intentions for improving patient care and accessibility. And within less than a year, they're closed down because the overheads are so high, and you don't even realize that you set up and you're like, it's online. How much could it possibly cost? But all of these insurance, they will get you. Marketing, that will get you. All of these things add up. So it says a total cost of 30,000. I don't know how true that is. I think it's probably a bit more. But under us, you basically CQC, well, registered under our CQC, so you don't pay really any fees. What you're paying for is £200 a month to be under our CQC, to use our infrastructure. So that includes the patient records system. You pay extra if you want us or our tech team to build your website. If you've got your website, then that's absolutely fine. And your for our platform, even for Uber Docs, you're paying your indemnity. So that also comes in. So you don't have to pay extra indemnity unless you're seeing hundreds and hundreds of patients, which is not usually what happens in the first few months. So I put down here £1,200 or 1,200, and that's because actually it's £200 a month. And I'm thinking, okay, if you're with us for 6 months, because after 6 months, it's not like we want to hold you forever. Usually, you just want to have a feel of it. Is this something I want to do? Is it feasible? Even with my when I started my clinic to do the thanks stop, I didn't just say, oh, I'm just going to do CQC and I'm going to do this. I actually came under somebody else's CQC. So you always need to feel, okay, is this working? Is this marketing working? Is it going to be too expensive? Do I actually like it? Always start with somebody. Never start alone and very expensive, and then you shut down and you think, actually, it didn't work. Sometimes you just want to kind of handhold and try and test different things. Remember, fail fast and fail forward. So you might say, I want to open a GP clinic, and actually patients are like, oh, well, I'll just go to my GP, and why would I pay you when I can just go to my NHS GP? But then if you say, I want to open a menopause, I'm going to be the menopause GP. You're still the same GP, but you've just opened an only, when you niche down, patients will be like, oh, I'm going to go to Dr. Smith. He's my menopause GP. He's the menopause GP. So when you niche down, then actually you can see that more patients are coming to you. So even though you think, oh, I'm going to be a general practitioner and offer a generalist service, patients get confused and basically compare you to the NHS and say, well, you're GP, so I'm just going to go to my NHS GP. When you start to offer a specialist service and say, I'm a menopause GP, they'll say, oh, actually, I can't really get that on the NHS. No, because this one's specific menopause GP, and maybe they can prescribe medications not on the NHS, like bioidentical hormones, some people prescribe. So when you niche down, you're a little bit better. And this is all the things that you test when you're under Rust. You don't want to sort of just go it alone and, spend thousands of pounds and then shut down and it's a bit of a disaster. You almost want to test it. And then when you can see it's working, you can feel like confident. Yes, you can break free and then you can go it alone. So it's not like we just want to keep you there. We do understand that you're going to be there for 6 months, 8 months. And then in that time, you're applying for your CQC when you're confident enough, and then you'll go it alone. Or if you want to stay with us forever, we're very happy as well. So that's what we cost. Those are our costs. So we're charging £200 a month for us. So let's move on. What time is it? Gosh, my gosh, I don't think I have time to go through the Uber Doctor platform. So platform opportunities. Okay, so many opportunities have come my way. I put down here LinkedIn. Every time I post on LinkedIn, at least 3 opportunities come my way. So I said I posted that quote the other day, earlier today. I was to say, CTC said this. And I think there's opportunities to say, oh, Linda, does any of your doctors do what's that called? Like those risk assessment forms, although I don't even know what they are. I've never done it myself, but I know people do these kind of certificates where if someone's suing the NHS because of long COVID and this jab or whatever. So they say, oh, does anyone do these kind of patient assessment forms? And I said, actually, a few GPs might do it, or if you want to provide training to them, I'm sure a number of GPs would want to do it because it's like work from home, work in their own time, and they get paid per report. Somebody else came up to me and said, actually, I've got a private GP clinic in this area, and we use AI, and it really works well. Would any of your GPs be interested in that? And I was like, actually, I'm sure I can just put it out to them, and I'm sure someone would want to do that. And then also somebody else, what was the other opportunity? I can't remember off the top of my head, but at least 3 opportunities every time I post on LinkedIn, because there's not been anything like this before. There's not like a platform that has thousands of vetted GPs ready to work, when they're able to. So that's why actually it's getting a lot of attention. A lot of eyeballs are on us at the moment, and this is because they want you guys that can deliver these services. So so there's lots of opportunities, NHS and private work. Instant notification via WhatsApp. We're not doing emails. Hardly anybody opens emails anymore. And brand partnerships. So even myself, I think I spoke to you on the last webinar, where a really influential influencer who has over about 4 million followers across her platform. She's like, okay, can we do a collaboration with skincare? So there's lots of actually social media influencers that want to partner with the GPs. There's a lot of pharma companies that are approaching us to say, actually, would the GPs be interested in discussing medication like, I don't know, Aveeno or, skin creams and eczema? A lot of, health tech platforms as well. They're trying to get off social media, or they just want a GP to sort of be their clinical lead and spokesperson. Lots of sponsored lunches and learns, CPD webinars from our private consultants. There's lots and lots of opportunities. And also opportunity for you guys to run courses if you have a specialist interest and you want to, because people want to learn. Our GPs want to learn from each other. So actually, if you're able to put on a course, then, there's GPs there that are willing to also, want to learn what you have to, that thing that you understand and share your knowledge. So questions. So these are some questions that I was getting, over the last couple of weeks. Okay, so can only GPs run private clinics? So the answer to this is no. Only GPs can work on our platforms, but it's not just GPs that can run private clinics. A lot of private healthcare providers are not GPs. So even when I worked, when I was a salaried role in an urgent care centre, the company was a private company, and I think one of them was, I don't know, worked in property before, and another one was worked in a charity before. So actually, a lot of these clinics are run by private providers. And they are non-medical. So yes, if you want to open a clinic and have GPs work, under you within your clinic, yes, you can. So, anybody can open a healthcare clinic. and run it and be responsible for the oversight and sort of the management, and then the GPs can work within your clinic. So trending clinics, I say trending clinics or popular clinics. There's been a lot of discussion around longevity and a lot of requests for, okay, are you going to do a longevity clinic, especially from our pharmacy partners? I think the patients are more looking into like longevity and health and health prevention rather than sort of being very reactive. They're more sort of proactive. So longevity is big. Weight loss again is big. I think there was a post that came out, or sort of the news just broke, that actually the cost of Monjaro is tripling from September the 1st. So that's in 2 weeks. So with Monjaro, which is like a weight loss drug, never pronounce it, tirzepatide. So it's a popular one, and we actually had Dr. Sue Kennelly. I hope I'm pronouncing your name correctly, Sue. I'm always getting it wrong. So she's like a weight loss expert, and actually she's gonna work with us to provide one of the weight loss courses. I think I have a link inside the links that I posted in the chat. So so weight loss is huge. You can get Monjaro on the NHS and some of the other GLP ones, but that's the criteria is very, very high. So like if you're morbidly obese, like for obese related conditions. So still, again, a lot of people are going towards private providers. So now, before you could get like the lowest dose for about, I don't know, £120 or something like that. Now it's going to be, I don't know, £190 or even £200. So they're saying that the cost is doubling or tripling from September. So I'm not really sure what's going to happen there. So weight loss is a big one that's requested. Menopause is a huge one. IV vitamin drips, again, it's starting to come in. But there's something about the IV vitamin drip I'm not quite getting. But I helped open an IV drip clinic. But I told the person, IV drips is either you understand it or you don't as a patient. So it's either that you're looking for it or you don't get it. So it's not for everybody. So as long as you have your patient base, it will do well. If you don't have a patient base and you're thinking, oh, I'm just going to market it, people don't get it. Like people don't get, why am I paying £300 for vitamin B12 or for all of these? So maybe if you're in a longevity clinic or functional medicine clinic, or you have your patient base, it makes sense. But if you don't, and you're just trying to think, oh, this is a good idea, I've been there, not personally, but I've seen clinics do this, and I've told them, it's really niche. So just make sure you have your patient base, and they didn't, so it didn't really work. So opportunities, yes, opportunities. Anything that has been decommissioned from the NHS, so airwax removal, for example, or travel vaccinations. I think NHS GPs are perfectly placed, to signpost people. But then there's a caveat with GMC guidelines, good medical practice, that you can't promote your private services in your own NHS clinic or in your own NHS clinic. So how we work, because people come to us, even when people are coming to me in urgent care centres, I was like, oh, airwax, I don't know, go to, I don't know, Specsavers, like. But actually, why don't we direct patients to people that we know? So, for example, if you're Dr. A in surgery A with pharmacy A, you can say, if someone says, oh, do you know anyone that, does airwax removal? Yes, you can't tell them, oh, come to my service. I do, I'm trained in it. But you can say, actually, ask the receptionist, and the receptionist can say, why don't you go to pharmacy B? So they're not, the receptionist is not signposting them to you or your services, which can be a little bit like unorthodox. But they're saying, actually, go to pharmacy B. They can signpost you, and pharmacy B can have the airwax removal service. And the same way, if the patient from surgery B said, okay, do you know anyone that does airwax removal? That receptionist there, receptionist B, could say, actually, oh, I know pharmacy A, and you will be providing the services in pharmacy A. So you can work within each other as partners, work with your pharmacies as partners to offer services that they don't offer. So I'm always saying it's not about competition, it's just about collaborating and sort of thinking outside the box. I think we'll probably have time for questions here. So maybe I can answer. Yeah, I don't think I'm going to go through the Uber Doctors platform. I've been talking for over, oh my gosh, an hour now. So do you have any questions? I'd like to hear from the audience. So let me share my screen, sort of your ideas of private clinics. So if you're brave enough, you can sort of pipe up and, unmute yourself and, just say, what your idea is. It's really good just to put yourself out there. What is the worst that's going to happen? And sometimes you can get really good feedback. So something that you think, oh yeah, this is a sure win. somebody will say, actually, have you thought about this? Or I've tried this. So everyone here, I guess they want to open their own private clinic. So what sort of private clinic do you want to open? So that's the question to you. So let me stop sharing my screen. We can have a little 5-minute question answer. If you want to, and if people are still there, still alive, we can sort of go onto the Uber Doctor platform. It might take an extra 15 minutes. But this is just my time to breathe, my time to breathe, and questions over to you. So you can put the questions in the chat box or the Q&A, and I can read them, or you can come off mic and you can answer a question. So I can see a couple of hands up. Just come up. Sometimes I can't see everybody on the
Am I right to ask a couple of questions?
Yes, please. Hi.
So,
What's your name and
hi,
where are you?
Hannah, I'm a GP, and I specialise in functional medicine.
Hi, Hannah. Brilliant. Yes, shoot.
Hi. So I was just wondering, if we already have like a Semble account and we have, patient data, is it easy to transfer that across to your platform?
So our platform is bespoke. So there's no API integration with Semble. So that transfer might be more manual, but our tech team can help you with them with that. So we can transfer the patient data, but it will be manual because there's no API with Semble.
Okay. And then also, sorry to ask another one, but if we prescribe kind of compounding medications and we use compounding pharmacies already, can we still do that? Or is that going to be a problem?
Yes, you can use off license, you can use compounding. I use a lot of compounding medication. So they say as long as it's within your expertise and as long as you're competent to do so, then you can do it. It's not like you have to show like a certificate or whatever. I know us GP people just love our certificates, but as long as you've been doing it and you're comfortable doing it, then absolutely fine. Because a lot of medications is off license. A lot of medications can be compounded. So yeah, that's absolutely fine.
Perfect, thank you. And then, sorry, one final question. If we already have a location that we use, do we have to use the locations through your network, or can we use our own locations?
So you can use that location, but with our CQC, we are more of a mobile doctor service. So it's not like we have to register that. We won't register our location under us, but it's almost like you use it as an ad hoc. So it's not like you own the location. You're just there renting it as and when. So you're still fine to use the location that you're in. Yeah.
Okay, cool. Thank you so much. Appreciate it.
No worries, Hannah. Any other questions? Let's see. Some people just. Okay, I'm going to try and scroll down and read through what's in the chat box.
Hello.
Hello. Who am I
Hi
speaking
there.
to?
Hi there. My name is Dr. Diwani. I spoke to you before. I just wanted, if it was, so essentially, yeah. So I was about to start my own private service in minor surgery and dermatology as well. But I'm really excited about the things you've sorted out. So the CQC regulation, you've got the insurance, the integration with pharmacies, the referring. It literally sounds almost a bit too good to be true and perfect so far. But I just wanted to see. Just wanted to ask if we were able to see at some point some elements of the patient user experience. So do you have a demo website whereby we could just sort of potentially, it doesn't have to be now obviously because you're in the middle of doing your current presentation, but just so the patient goes onto a website, they click book, then what does the doctor do? They then select a location, or I'm just a bit, so it's just more about that finance sort of how does it actually happen that I'm quite interested in.
Absolutely. Good question. So yes, after this one, so my next slides were actually the Uber Doctor platform and how it looks. So I've got like the screenshot so you can understand, okay, this is the user journey, whether it's like the doctor, the pharmacy, the patient. So with patients, because at one point we were building an app, but you know what? There's just so many apps out there. Like there's just app fatigue. No one can be bothered to download another app. There's literally like an app to record your breathing. There's an app for everything. So we've actually just used WhatsApp because WhatsApp has, I think, 80% penetration in the UK. So everyone knows WhatsApp. Everyone uses WhatsApp. So our platform is web-based. So it's basically a dashboard. You sign up and you go on your dashboard. And so what happens is the pharmacy or the business has a dashboard. they request on behalf of the patient, or the patient can request via WhatsApp on the pharmacy website. So let's say the pharmacy requests on behalf of the patient's standing in front of them. So they've done this pharmacy first thing. So pharmacy first is like there's 7 conditions that pharmacists can treat with PGDs. What does that stand for again? Patient group directives. So, if they're not prescribing, they can just use this and say, actually, the patient can have this. But a lot of the patients are getting a bit disgruntled because they fall outside of that criteria. So when they fall outside, sometimes the pharmacists say, okay, we either send you back to the NHS GP where you wait for 3 weeks, or you could go private. So what happens is the pharmacy then books on our platform, I've got a patient in this location. Is there any GP? So the request gets sent out. If it's just an online, it gets sent out to all the GPs. If anyone can do that consultation, they just book accept, and then the link, so the link for the telehealth link, so like Zoom link or whatever, then they'll see the patient through that link. So that's how they do it, and then they can prescribe as per normal. So that's almost a user flow, but we have it on the next slide if you want to stay. I know some people have to go at 8, but we can probably go through it sort of quickly.
Okay. But thank you. And then just one final question as well. So so quite obviously, being me myself as the GP, I'm signing up. This is my private service. Whilst I run that service, am I able to say, for instance, have 2 physician associates that work under my supervision? If they've got a specialist interest, they consult with a patient, but then I then review their notes and their history, and then that's okay. So they're almost staff under my service. Is that something that's okay?
So so that's a really good model. And also like nurses have said, can we also, can it be GP led and then nurses, under them, especially like pharmacists. But actually, because our insurance is only for GPs providing these services, so that's why we're not able to have like physician associates or nurses or anybody else because of the insurance. I think maybe in the future that's fine, but then in the future then we have to understand, okay, what are the criteria that physician associates have to meet? Like, so I'm not really familiar with that, and that's why I've just said, okay, let's just do GPs, because I know onboarding, I know the compliance, like Statman training and all of the compliance, but for physician associates, I really aren't aware of it. So short answer is actually no, you can't have a service where other allied healthcare professionals are seeing the patients directly, because it just, it invalidates our insurance. Yeah.
Thank you, Linda. Thank you.
Thank you. Cheers. No worries.
Sorry, I have one more question. This is Hannah again, just off the back of that, talking
Oh,
about
hi,
insurance.
Hannah. Yes.
Hello, sorry.
Yes.
So I already have specialist functional medicine insurance through another company, which I've paid for like the year. Am I able to continue with my own insurance as well, or do we have to come under your insurance?
So for the Uber Doctor platform, it would be our insurance, and I guess it would, yeah. So I think because we were in 2 minds, do we actually just have GPs source their own insurance, or shall we actually cover them and they pay a monthly fee of £29, and that's for all of the insurance, including the indemnity? So actually, when we looked into it, the GPs to get their own insurance was quite expensive, and with the functional medicine, I think it's quite niche, so I don't know what it covers. And with RCQC, they say, okay, make sure that the insurance. So it's really difficult to look at everybody's individual insurance and make sure that it covers everything. And it might say, you might want to do a telehealth consultation, but it might not be, I don't know, covered by functional medicine. So I think as a blanket rule, we want everyone to come under our insurance, because we know exactly what it covers and what the GPs can do and what they can't do. I think when you start getting quite niche, because you said functional medicine, isn't it, Hannah?
It's functional medicine, and so it's quite like I paid for like the highest level of insurance to cover me for all of the kind of the off-license prescribing and recommending supplements and herbals and stuff like that. So would your insurance cover all of that stuff?
I'm gonna have to, so I think it's actually easier, because when we speak to insurance providers, they say, okay, give us a list of everything that the GPs are doing. So with our Uber doctors, we've got like a set list of what you can and can't do, because actually when people are requesting services, it's not like a free text. It's like, I want a GP for menopause or this, or just, for telehealth or hay fever injection. So they've only got a set number of things that they can select. If you're now doing private clinic, and actually it's a lot more than what you can do on the Uber Doctor platform, then actually we might have to say, okay, we have to do it case by case and look at what you've got and then say, actually, you're better off to have your insurance if you're going to provide these services. But we'll probably have to submit it to our providers as well, just to make sure there's no clash and it's not sort of cancelling each other out, because they always say if you've got insurance by one provider, you can't have it somewhere else, otherwise it just cancels each other out. So I'll have a look into that, but it's not a complete like no. I think that sounds, to me it sounds straightforward, but I just want to I would have to submit it via our insurance providers.
Okay, perfect. So it can be dealt with kind of on a case by case in those kind of niche
Yeah.
situations. Okay, cool. Thank you.
Yeah, no worries.
Linda.
Hello.
Hi, I'm
Yeah.
Mel. I'm a GP up in Liverpool.
Hi, Mel. Excellent.
Thanks for the talks. Absolutely great, and lots
Thank
of
you.
good information. I had two questions. One of them was, would the CQC cover testosterone prescribing? Because obviously in GP we don't do that as much as say HRT. That's the first question.
Yeah. Yes. The short answer is yes. No, I specifically made it clear that testosterone replacement therapy, because a lot of the pharmacies, especially in the affluent areas, were asking for that type of clinic. So I actually put it on my CQC and as part of the insurance. Yes.
Perfect. And my next question was, I've got my idea together. I'm quite at the beginning of this kind of journey, setting up the clinic. Is there like a time frame where you have to kind of commit to joining Thanks Doc, or what's your kind of plan for the rollout in terms of how many clinicians you take on over a certain time?
So we want to take on 5 clinics to begin with. We already have 3 people on, so we've got 2 more people, because we almost want to, like, with healthcare, you can't sort of move fast and break things because of the, there's issues. So we always want to start slowly, especially with the clinics, and just make sure actually they're all fine and things are not going wrong, and then we can roll out to get 10 at a time each week. So we're going to start off with, at least for the first 6 months, the 5 clinics.
Right. Will we get more information like on the WhatsApp group or via email?
Yes, so we're launching on Monday. So you'll have I think there's a link that I've put, the sign up link there. So with all the newsletters, they'll all go out and explain in terms of how you can sign up, and on our YouTube channel we're going to have the video, so even this recording will be there. So you'll have information via the newsletters and also the videos as well, and then WhatsApp group. Yeah.
Right, thanks so much.
No worries, Nell. Thank you. I can't see any questions in the chat. I'm going to go to Q&A quickly.
Sorry, Linda. Hi, it's Sunny Desi. I'm a GP as well.
Hi, Sunny.
Thanks very much for the talk. Really appreciate your time. I'm still stuck in clinic as well. So I run a clinic. Started with aesthetic medicine, just like yourself. Then realised I should switch back into private medicine and play for my fortes, which is private GP. So I've done all the CQC, doing private medicine. So obviously, I wish you'd come up a few years earlier. It would have made life a lot easier.
Yeah. Which I thought about it then. I do love it.
Yeah, well, we'll let you off for your eureka moment later on in time. But no, that's good. So, very keen to potentially utilise Thanks Doc as well. Obviously, we've already got to say, but it's the CQC compliance level, because obviously I work as a medical director for a company as well, and that's almost a full-time job. So I'm just thinking from your point, like how, because obviously there's audits that and that's for each individual clinic. So how will that work then? Is it going to be from the top down, where you'll be like, right, every month you guys need to be sending me audits of this and everything you're doing, and or is it going to be run in the background on your software?
Yeah, so it's almost going to be from top down. So even though you have private clinics, you're still using our patient electronic record system. So we still have access to what you're prescribing and the patients, etc. Make sure that they're, the consultations, are fine. So we will be looking at that, and if you're running the clinic, then we'll say, okay, can you audit it in accordance to our audit schedule? So whenever you're doing CPC, you'll know this, Sunny, that actually you'll have the audit schedule. So you might say, okay, infection control every 3 months or whatever, prescribing every whatever. So you still audit according to our audit schedule, but we'll still have sort of clinical oversight of what's happening. So you'll audit and then we'll check what's happening. So our audit, I think it says, 10% of your patient cohort check the prescriptions, make sure there's no dangerous meds or whatever being prescribed. So yeah, so according to our audit schedule, but then we'll oversee it.
Okay, and I'm sorry, I might have missed it, but in terms of the software that you're using, it's bespoke. It's okay, fine, all right. Because I have the same issue, I think, as Hannah, where I'm using Columns, I'm using Semble, so and now Randox have started charging us for using their dashboard as well. So so you get okay, cool, and okay, that's fine. Thank you very much, appreciate it. I'll wait for the newsletter to come out in terms of signing up and stuff.
Fab. Thanks, Sonny. So I think we've got a couple of minutes. You guys have been very patient. I can quickly do a whistle-stop tour just through the Uber Doctor platform. So let me share my screen with you. If some people have to get off, that's absolutely fine. But we're going to. There is a tip in this one. This one that's actually good because there's a secret tip that will make you get ahead in the Uber Doctor platform. So it's good if you can stay and then you get that tip. But if not, the recording will be there. But people, might have already sort of capitalized on that tip. So let's continue. You can all see my screen. Gosh. Okay. The computer's thinking about it. It's quite slowing down. There's a bit of a lag. So I put in the links in the chat a link called app.thanksdoc.co.uk. So if you go to that link, you can go to it now, but it has like a timer, we're going to launch in on Friday midnight. So that's when you can actually sign up to the platform and start onboarding your compliance. I'm so sorry for the guys that have already submitted their compliance through our other compliance platform. Everyone was like, oh, is it after? Have I submitted? Have I not? So we had to just like change everything. So we still got your position in which you submitted it in, and we're still going to onboard you via that position. But you just have to probably just use those documents and just upload it via this way. So I'm really sorry about that, guys, because like when we trialed it with our sort of pilot team, they were like, oh, it was just a bit of a headache. So we've got a new sort of compliance by submission. So when you go to the app.thanks.co.uk, you'll see here, register your business. So that's for the businesses, the pharmacies, or join as a doctor. So you can either sign in or, join as a doctor, join as a business. Yeah, register a business, register a doctor. So you'll sign in and then you'll get this page. This is just basically where you put in your details. So it's pretty self-explanatory. Your number, your bio, don't worry too much about your bio. You can put some, once you're on your platform, you can always change your bio there. And it just helps people know a little bit more about you. And then the services you offer. This is very important because this is how the businesses also pick the services. So they're linked. So for example, if they say, the pharmacy says, I want a GP that can do hay fever injections, and it's like £99. So there's got a patient there wanting a hay fever injection. If you tick it here, that will go out to you. So number one, it's going to be very spammy if you think, actually, let me just tick all of these services, even if you don't offer them. And also it's going to be like, it doesn't really make much sense because actually accidentally you might click on it and then suddenly you're in front of that patient who's expecting the hay fever injection and you don't give it. So these in-person, so all of these services should be services that you're either have a specialist interest in. Otherwise, it's just general. So in-person consultation is just general GP. Private prescriptions is just general. But it's only when you've got these kind of like the gypsies with, the gypsies or the GPs with extended roles, then you can start doing these sort of specialist clinics. If I've missed any of the specialist clinics, do let me know and I can put them on sort of back end, and then you can be requested for them because actually we do have businesses. So one actually came to me. He's got like an antenatal or early pregnancy scanning. So kind of like it's not the same, but it's like window to the womb. So when people want sort of 3D baby scans, well, now what he's adding on is GPs that have an interest in fertility and women's health. So he actually is saying, actually, I want these GPs. So if you've ticked, women's health, then he'll be asking you, he'll be requesting you on the Uber Doctor platform. So if actually, you're not really so, strong in women's health, probably it's best not to tick that because actually you'll be put in front of like a a pregnant woman trying to give her like information, or and you'll just be a little bit stuck. So pick the services that you're confident at or confident in. So yeah, so there's lots. So that's I think Dale asked me about the testosterone replacement therapy. So that's there. So that was a request. Also online services, so everyone can do these referrals, scans, letters. Take notes. I'm not sure what mental health is doing there. I think someone wanted to do. No, I think so I'm not quite sure what that's doing. I might have to take that one off. And then you put your location. You also have to put get my location. So this basically allows the computer, because it's all like geolocation and GPS. So that's how it's like, okay, they know where you are. You can always change it when you're inside your dashboard and inside your profile. You can always change it because you might be moving from somewhere to another place or whatever. So you can get my location, add your location. So you meant to put in those. Yeah, so it just says, know your location. So sometimes people never allow or like block, but then if you get confused, like, where are you? So it's like, it won't send you the relevant jobs. So there might be a pharmacy like literally right next to you. You can be in a GP practice, have like an hour break. There's a pharmacy literally next door to you, and a patient comes in and says, oh, can I have this? It's like the pharmacy would be looking for a GP, £50 for a 15-minute consultation, and you could literally like nip around. But if you don't put your location on, they just won't know where you are, so they won't be able to find you. So it's important that you just pop your location on. And there's going to be like a more in-depth training, but I just wanted you to have an idea of how it works. Okay, make sure that you verify your email before logging in, and then you'll just get the verification email. This is where you put your compliance documents. So this is me, test doctor. Baby Skincare was my old clinic. So I'll have your information here on your dashboard. When you've made money, you can see it here. You can click on all of these and see your old job, etc. Here you'll be able to see the requests coming through from the pharmacies or the businesses. So you'll be able to see it all here on your dashboard, but also you'll be able to see it on your phone via WhatsApp, because it's linked to your WhatsApp. So when you're putting in your email address and your phone number, it should be the phone number that you have WhatsApp on, because that's where you're going to be getting the notifications. And it's literally faster to click it is the one that gets the job. That's how that's just the fairest way. So we've got the compliance documents here. So just 22. I know it sounds like a huge amount, but once it's there, it's there. And it's mainly Statman training, like fire safety, infection control, Oliver McGowan, like basically all the about 12 of the Statman, and then it's like GBS, passport, like right to work, etc. So these are compliance documents. So you just kind of upload them. There is an auto expiry date. I think that's on the next one. So this is just to keep us compliant, because we have a huge number of GPs on our platform, and sometimes it's really hard to check what's expired. So you upload it, you put the date of the certificate, and it manually, because it like expires over sometimes conflict of resolution, you have to do it every 3 years. So it knows automatically when it expires, and it will tell you, okay, I think it gives you a month's notice or a week notice, depending. That it's about to expire, and the minute it expires, then you're off the platform. So you're still there, but you can't accept any jobs, because we have to make sure that you're fully compliant. So you have to make sure, actually, when you get the reminder, this is going to expire in a month, just quickly do it on, e-learning for health, or just do, we work with a compliance agency that gives all this Statman training. So some things are in person. So if you need to book in person, there's a place to book it. Just make sure that you're fully compliant. Otherwise, it stops you from accepting any jobs. This is a tip, guys. This is a tip. So if you're here, this is why you should sign up quickly, because what happens, I'm getting a bit. So the pharmacy says, we want continuity of care. We want the same doctor sometimes. So where, when pharmacies or businesses are requesting a doctor, they can just shoot out the request, you can see here, to any available doctor or a doctor I previously worked with. So actually, it's in your best interest just to sign up quickly, because, when pharmacy, it's brand new. So you're likely to get sort of a couple of the first jobs. So then you're known to that pharmacy. That pharmacy knows that actually you've seen their patient and you've done a good job. And actually, if another patient comes in or they want another service, let's say, they know that you've done a menopause clinic, online menopause clinic for this patient, and the patient was like, yeah, the doctor was amazing. They're going to say, rather than shoot it out to any random doctor, and it'll be a little bit of like a Russian roulette who they get, they'll rather go with a doctor they know, go to the doctor that's had a good review. So this is why actually it's good to sign up first and just have first user advantage, because the pharmacies have the option, and it's not almost like gameplay, because sometimes they want to be able to request the same doctor. So it's not some weird, I don't know, marketing tactic. I'm like, sign up quick. It's just because they said, is there a way we can always request the same doctor? Maybe, for example, I think in some of the pharmacies in Edgware Road. So Edgware Road has quite a large Arabic community. So sometimes they say, okay, I want this doctor that's come before. They were really good with our patients. They spoke Arabic, and we had really good service. So rather even than bringing me that I don't speak Arabic, and maybe there might be cultural differences, they'll be like, no, we're comfortable with this doctor, we've seen them, etc. So they get to that's why they've actually asked for this feature to be in there, so they can request a doctor that they've worked with previously, and it goes with all sorts of sort of cultural situation or nuances. So when the pharmacy actually requests, they pay at the time. So it works like Uber. It's not like we'll be chasing invoices or have you paid this, have you, nobody has the time when there's 5,000 GPs on the platform. So they pay, and they pay at the time of the request. So the money is held, and then after the service, or I think it's about 24 hours, it goes into your bank account. And it's not the whole money. You'll see here that it's actually our platform works, but that we take 10% charge, and that's how we monetize. So we cover all the platform fees, all of our overheads, everything, because we take 10% of whatever you earn. But you'll see it on the platform. It wouldn't show you the total money, like the gross profit. It'll show you like the net profit, so minus our fees. Oh, I've got that in the right order. Like I'm on Dragon's Den getting my figures wrong and my the definition's wrong. Okay, so the doctors get this. So this is me as a doctor, Dr. Vein Skincare Test. So I'm the doctor here. I can see that the test business here has requested. Oh, they can see, okay, a patient has a UTI and they fall outside pharmacy first criteria. Please help. I don't know why it's 1 hour. I think it's meant to be like 15 minutes. You don't. Can you imagine as a GP if you got 1 hour to treat a UTI? Bliss. So you can accept it here on the platform. Otherwise, it goes here. You can see it on your WhatsApp. We're trying to get this into a button, but you can see it on your WhatsApp. It will just come to you, say, "Oh, hi, doctor. This is a new service. Service for letters." Oh, it was a different one that I did when I was testing it. It's letters. Its location, but it's going to be online schedule. So you can put accept, or there's another button when you scroll down. It says decline. You don't have to press decline. You can just ignore it, but you can accept, and then that automatically goes to you. So you can always check your dashboard for all the jobs that you have accepted. Is always going to be on your dashboard, and all the ones that you've had in the past, etc. And then so it's not just on your WhatsApp. So when you press accept, you'll get this, successfully accepted, and then you just get some information, how you can contact like the pharmacy or the business, and when you scroll down, you can read more about it. And you also get an email. So yes, we have it on WhatsApp, we have it on your dashboard, and we have it on email. But with me, even as a locum, I was getting like, not anymore, but back in my heydays, I was getting loads of emails. I wasn't opening half of them. Yeah, but on my WhatsApp, I'm always on my phone, and it's just easier. So that's why we've done it via WhatsApp. The pharmacy end gets this. So they've already pushed out a request, and then they say, oh yeah, actually your doctor has accepted. So they can even call the patient and say, no, how are you getting on? The doctor has accepted his request. Was it a good service, etc. So they know also what's going on in the background. So the business always gets a notification as well. Otherwise, there's some businesses that we want notification, or they don't have like a personal number, so they might just have like an app, and then you just get email notifications, so they don't need to have like a number. I think that's it. Yeah, so that's it. Yes, just we've reached the end. Wow, I was a bit shocked there. I thought this went on for ages. So that was a quick whistle stop talk. But there is going to be, I'll stop sharing the screen. There is going to be training videos. So on our portal, like on the Knowledge Hub, you'll have all the training videos, all the links to all the referral agencies. If it's a social service referral, because there's always like safeguarding policies. It will all be on our Knowledge Hub. So don't worry if actually this wasn't really like useful, but actually the walkthrough in terms of for example, our patient platform, so our electronic medical record software is going to be there, the training video is going to be there. And actually part of the compliance is saying, yes, I've watched the video. Yes, I'm comfortable with learning how to use this. Oh, yes, I've trained on the prescribing platform. I've got my username and login, etc., etc. So you have all the training videos, and our our prescribing partners, they are so good. So they have like a line, direct line straight to them, because when you prescribe, yes, the patient can go to any pharmacy and pick it up, but also it can get delivered within 24 to 48 hours wherever you are. So you can even pick up and say, oh, do you have this medication in stock, or what's going on or whatever, and they'll answer straight away if you have any queries. You can see the cost of the medication in front of you, so you can take over the patient. If you're more of a private clinic, then there's a way that you can also add your margins on and send it to the patient, send the invoice to the patient pays, and then the pharmacy takes their cut. So so you get all the training videos whilst you're onboarding. So you can start onboarding when the site goes live, midnight on Friday. And so that countdown. So you've got the app.thanksdoc.co.uk. Those who have already submitted their compliance, I think there's about 400. I'm sorry, guys. You can also upload it on this new one, but we've got your order, so we know that when we're saying yes, because not everybody's going to onboard on the same time, we are staggering it, because when you've got such a large number of GPs, you just want to make sure that you're safe. So yeah, we're not going to be like, yes, everyone, off, you're off on your own. So we're just going to have to like stagger it. Maybe it's going to be like 50 GPs a week that can start to onboard on the platform. So it's really important that you onboard quickly, because you've got that pharmacy that can say, go with previous doctor. And sometimes it's not about the best doctor, it's about just who they know, who they're familiar with. You've said hello, you've done service for the patient. So that's where we're going to be. Are there any other questions, or is it clear as mud?
Sorry, I do have a question. I've just been on the ThanksDoc website, and I've put my details in the form to join the waiting list. Is that all I need to do at this stage, or is there some other way that I need to be joining? I'm not on this WhatsApp group that you're talking about, or.
Oh yes, the WhatsApp group is closed. I think we've got there's about 400 there, so we're not taking any more in the WhatsApp group. So they tend to get the notices first, because they're almost our pilot group, and but then if you're on the wait list, then you get the newsletters. But in terms of signing up straight away, you guys can sign up straight away, because you've got app.thanksdoc.co.uk. So from Friday, even if you put it in now, it will say, okay, we're going to be launching on Friday or tomorrow at midnight. Then you'll be the first person on. So even I'm going to just put a notification to the WhatsApp group so that they know it's there. But actually, you guys on this webinar, you are the first person that I've released that link to, so that URL to. So only you guys know about it at this moment in time. Everybody else doesn't, not in the WhatsApp group, know about it. So just sign up via that platform.
Okay, thank you.
Okay, brilliant. Thank you so much for joining. Is there any other questions? Yeah.
Yeah. Hello, Linda. Congratulations on the presentation. It was great.
Thomas, how are you? Yes.
So I always try to support you. And
yes.
Tell me if I registered early. I mean, if I was from the beginning with you and was watching everything, and I registered early and sent all my documents on the previous system.
Yes.
Because I've watched you now, and if I register by this, should I register it again through this new platform, or should I wait for the decisions and feedback?
Yes. So you're absolutely fine. So everyone needs to register on this new platform. This is the one that's going to go live. And yes, Thomas, you're my biggest cheerleader, because you're always there in the WhatsApp group going, this is great, I can't wait. So yeah, I think you're in the top 3 of who registered first. So we still got the people who registered first, but it's just easier to put it on this platform.
Thank you.
Everything's happening. Yeah.
That's what I wanted to know. Congratulations again.
Work.
Thank you.
Yes. Thanks so much, Thomas. Cheers.
Linda.
Sorry.
Hi, it's Dia.
Yes. Hi, Dia. Oh, I can't see anybody.
Hi. I haven't put my camera
Delia.
on.
Yes. Hello. Welcome. How are you? We're gonna have you on soon.
I'm good. Thanks. Yes. So Linda, can you share that link again? Because I had to leave and I've come back in. So is it possible for you just to share that link again? Thank you.
Yes. Let me pop that one in. So it's on our, actually it's not on our website, it's a subdomain. Let me share it now. It's app.thanksstock.co.uk. I'm just going to pop it into the chat.
That's brilliant. Thank you so much.
Yeah, no worries. Let me put that into the chat. Yeah, it's going in here. Excellent. Any further questions?
Hi, Linda.
Yes.
Hi, thanks very much for just a brilliant presentation. I'd really be interested in the kind of weight loss, but I think I need a little bit more sort of training to get myself up into that. So how do we sign up for the training side of things?
So for the one second, I don't actually think I sent all these URLs. Sorry, Charmaine, I'm just going to. I thought I sent them before, but I probably did. I didn't press send. How good I am. You know what? Like, technology is not my strong point. So thank goodness I've got a good tech team, because I literally was like, oh yeah, so I find the links, and actually I hadn't pressed send, so that's good. But in terms of the training, so I've just sent the links there. I think I've got Dr. Sue Kennelly's link there as well. She was our weight loss. She done a webinar on weight loss. So she's been doing weight loss for
I did that
a number of years. Oh, you did that? Yeah. So there's a sign up form somewhere there. I'm just like skimming through. Sign up form.
Is not showing.
Is it? Can you see the links in the chat?
Yes. Yeah.
Okay. There's one that's CPD courses. Register your interest. So
Mouse. Oh, okay. Yes. Come now.
Yep. So we've got the courses. So you can, because there's going to be other courses like Denia that came on before. She does like functional medicine and acupuncture. So she's going to also be doing a course as well. So with these courses, you can say, yes, I'm interested in a course. Yes, it's going to be one by whether it's weight loss. I think there's an option where you can pick what course or just free type, and then we'll get the people, because a lot of people have, like, a lot of the GPs have specialist interests, and they've been doing it for years and years and years. So of course, they're in a great place to provide this course, and we basically just get it CPD accredited. So it's also good for your price. Excellent. Any other questions?
I have a quick question, Linda. We've been speaking with Mavish here. Would you CQC?
Hi, Mary.
Hi. Would your CQC registration covered aesthetics work as well?
So
injectables.
They do. So yes, Botox and fillers, yes, they do. Chemical peels. I think there was one that they didn't cover. So we just have to check that one. But it was like major, microneedling, injectables, chemical peels, like microdermabrasion, the general.
And what about dermal fillers?
Yes. So with those ones, they're not CQC regulated because they fall under aesthetics, but it still comes under our insurance. So when you're paying the platform fee, it comes under that insurance, so you don't have to have another insurance. So it covers that.
Sure. I just wanted to just ask quickly. I want to start my own private clinic, and I have already registered. So is there anything else I would need to do at this stage for this to come under CQC umbrella?
No. So for that one, you can message me. I think I've got like a private clinic sign up form. And you can join, because even to join our private clinic, you still have to be registered on the Uber Doctors app. So that's app@thanks.co.uk, because we need to do the compliance. So still just sign up to that. Once you're on there, then you can also message me on WhatsApp, and I'll send you a link, because we're now taking a deposit, because a lot of people have registered interest, but it's the first people to do their deposits. So once you do your deposits and you're also registered, then we can bring you in. So I think just message me on WhatsApp, and I'll send you that deposit link.
Okay, great. I'll
have it on the newsletter.
Amazing. Okay. Thank you very much.
Brilliant. Thanks so much, Mary.
Can I ask a question, please?
Yes, please go for it.
The link for the website in a week, is that for people who don't have a website already, or is it also for people who have a website and would like to be on the platform?
No, so if you want to be on the platform, that's absolutely fine. So it's only if you need a website. So it's not a prerequisite of having, having a private practice or being under our CQC. So if you have your own website already, that's absolutely fine. You can still come under CQC and be on our Uber Doctor platform, but it's only if you don't have a website. Sometimes some people's websites aren't compliant to be under our CQC. So some people, because they CQC, if we're regulate, if they're coming under us, they have to make sure that their website has our terms and conditions, our privacy policy, even how a patient books. So the CQC will say, well, how does the patient book? And if it's completely different to actually what our process is, then they're like, well, how do you safeguard this, or what is the because some people's booking form says, what is the concern? The minute you put what is the concern, that means you're a triaging service, because they've said chest pain. So if they put chest pain there, and then they put in the booking form, and their appointment is in 2 weeks' time, that's going to be a big issue. That's a big safety issue. So that's why we don't actually put in what is your complaint. Just put your contact details, name, address, whatever, so you know that we're not looking at your clinical criteria while you booked in. Because then if you put that in as a patient, you might think we're triaging it. But if we don't ask for it, you know that you haven't told us any clinical information. So it's literally just when we turn up and we're in front of you. So that's why actually, even the way that you put your booking, how patients book for your service, is really important that it's kind of similar to ours. So you can have your own website as long as it kind of falls into kind of what we do.
Yeah, my website is very basic, to be honest. My website is just like an about me, what I do.
Yeah.
And check my Instagram page and LinkedIn, and book through Calendly kind of thing. So it's not if you suffer from this and book through this.
Absolutely fine. Yeah. So that seems okay. So you definitely won't need a full-blown website in a week, which I think is costing £500. It's somewhere there. But you might need tweaks to the website, which might be I don't know, £100. I'm going to just double check with the tech team in terms of if you need to make sure the terms and conditions. Otherwise, we'll just send it to you and you just do it on your website on your own. So it's up to you.
Okay, that's great. Thank you.
Okay, no worries.
Hi, can I just
Hi, sorry. I'm Narisha. I just wanted to ask a quick question, because a lot of doctors will be now private, and so appraisals could be a concern. Or is there any kind of plan to become a responsible officer to provide appraisals?
Not in the pipeline. I think there's Independent Doctors Federation. I think they do the appraisals. But if anyone's interested in it, they can happily be like, yes, I'm the go-to for appraisals. That's absolutely fine, because people have asked me personally and say, oh, do you do appraisals? And we don't. So if anyone's interested in it or does it, then they can offer that service to our GPs and that are fully private.
Great, thank you.
Yeah.
Linda, sorry, just on the back of the other question earlier.
Yeah.
About so if could I use the your system for my acupuncture patients? So let's say booking patients for acupuncture on my website. So so using your clinical system to record my acupuncture patients' notes.
Yes. So using that electronic medical record system.
Yes.
Yes. Yeah. Absolutely fine. So for anyone that comes under RCQC, that opens a clinic under us, they'll have to use our electronic patient records, and this is just for governance. So we have to make sure that they're under us, so they're basically one of our doctors, and working in line with our policy. So yeah, you'll have to use our
Okay. No, that's fine. Thank you so much. Thanks.
Thank you. No worries. Anything else?
Hi, Linda. Hi, can you hear me?
Yes, I can hear you.
Hi, my name is Sab. I'm one of the GPs from Oxfordshire.
Fab. Thank you, Fab. Yeah, shoot. What's your question?
I think I need a website, but obviously you mentioned the cost briefly. That's what, £500, and I mean, what do I need to do next, and how quickly do you think a website will be designed?
So the website, we do it website in a week, so it's very quick. So there's a what's it called? There's a booking form. I put the link in here. If they're called, oh no, that's website in a week. Okay, it's called, yes. So you can say, have a look at our demo site. It says demosites.thanksdoc.co.uk. So when you click on that URL or that website, then you will go to, and it will just talk you through it, like, you know, book here. I think once you book, you pay. And then it doesn't mean that because you book via Calendly and then you pay, but it doesn't mean that someone's going to like sort of talk to you then and there. But they basically call you when you're available. You get on a meeting with them, like a you know, be 1 hour meeting. You choose your template. So there's a number of templates on that website, and then you also give us the content. If you don't have the content, then we just generate the content for you. You just tell us a little bit of brief, like I want, you know, a clinic that is, you know, mental health clinic and it offers this, etc. So we'll do the content for you. If you don't have a logo, we will do the logo for you. So you basically just talk to our tech team to tell them what you have, what you need, and they take it from there. So it's done. It's up and running within a week, and it includes hosting for a year. So the hosting is free. There's no other costs for you. And then after the first year, you pay for hosting, and I think it's £7 per month. I can't remember, but it's on the website. All the prices are there.
Oh, brilliant. Thank you. And then in terms of marketing the website, if I wanted to share the link of the website in various channels, for example, I worked in New Zealand for a while and I want to sort of target QEs in London. So it's my responsibility to share the website in terms of marketing, is it?
Bravo.
Yes. So,
okay, go around that. Help everybody there, please, ready.
One second. So I think no worries, no worries. I do that all the time, so that's absolutely fine. So I think in terms of marketing, yes. So we do have someone who does SEO. It is additional. So when you go on the website, it will say additional SEO package. I think it's £99 per month, whatever. But I think as part of the package, we put you on Google. So we put you on Google My Business. So when people search in Google, you will come up. But with SEO, it's on an ongoing process. So it's almost like creating blogs, like, I don't know, 4 blogs a month, you know, about men's health. Because when people are searching, sometimes they land on your website because you've created a blog or an article about, I don't know, male pattern baldness. And that's why people land on your website. So with SEO, it's always ongoing. So every month you're releasing new content. So when people search in Google, it comes on to one of your blogs. So there is an SEO package. There is a marketing package. So you can add them on, or you can just go for the standard package, which includes registering you on Google My Business. So you're, you know, if you Google your own self, you'll come up on Google. So, you know, and I think their packages with getting your phone number, etc., etc. So yeah, have a look at the website and it will show you all the features and all the costs there.
Thank you so much. Thank you.
Thanks very much. Cheers, Seb.
Bye. Bye.
Fab. You guys have done wonderfully well. It's been an hour, 45 minutes. I'm going to finish in an hour. It's like double the time. It always happens. It happens. But so happy to have you here with me, guys. And I will be popping this recording on our YouTube channel. It might be in a couple of weeks' time. If you have any questions, then it's info@thanks.co.uk. Otherwise, I have my if you go on thanks.co.uk, I have my I think WhatsApp number, etc. And otherwise, follow me on LinkedIn. That's where I put all of my shout outs and updates as well. So it's Dr. Linda Odogwu, ODOGW. If you search me on LinkedIn, I'm there, or search thanks. Thank you so much. And I will see you next week for our weekly webinar. Thank you.
Thank you.
Thanks. Bye. Bye-bye. Thank you so much.
Bye.
Thanks, Linda. Bye.
Bye. Thank you, everyone.